Good day, listeners and viewers. On today's COVID-19 update, Minister of Health Dr. Frank Anthony addresses the efficacy of the Pfizer vaccine and the ministry's planned vaccination program for children.
Well, a couple of things. First of all, Pfizer is one of the mRNA vaccines that has received the emergency use authorization. Initially, it was done for persons 16 years and over, and more recently, the FDA in the United States would have approved it for children 12 years and above. Currently, you also have a similar thing with the Moderna vaccine, which is another mRNA vaccine. They too have received emergency use authorization and can be used in children between ages 12 to 18. In terms of us trying to access those vaccines, we've been working very hard with a number of partners to try to ensure that Guyana can benefit from some of those vaccines, and we are hoping that we can get those vaccines into Guyana very soon. The vaccines, however, they require special storage. So in the case of Pfizer vaccine, the vaccines from Pfizer, it requires a storage of -70, -80, and you then have to get special freezers to be able to maintain those temperatures. We have procured those freezers. We did so in January of this year, and we have a freezer bank that has been set up to store these vaccines. Once it's stored at -80 or -70, within that temperature range, you can then move it from there, bring it down to -20, and then subsequently to 2 to 8, and then ultimately you can give it to the patient. So you can have a gradual temperature breakdown, but it's more difficult if you reduce the temperature. You cannot then refreeze it. So it comes with certain peculiarities. We have since started training of our staff on how to store the vaccines, and we have procured additional equipment to make sure that we can store these vaccines properly. We have also, the vaccines would come with special syringes. We have received those syringes yesterday, and we will commence training staff to use these types of syringes. And once we complete that, we'll be ready to start the rollout of this vaccination program. We have had discussions with the Ministry of Education, and through the Ministry of Education and through that collaboration, we'll be working to make sure that children who are in school can have access to the vaccines. We will be using different modalities to make sure that children who are at school can get access to the vaccine. And all those out of school youth who would be between the ages of 12 and 18, once we are in that community, they can come to that vaccination site and access the vaccine. One of the requirements that would go with this particular vaccine is that we'll need the permission from the parents. We have started sending out letters to parents, and they'll have to sign those letters and send them back with the child so that we know whether or not we can vaccinate the child. So that's a very important component of this program, because the persons under 18 cannot decide for themselves, but their parents would have to give consent. So those letters, the Ministry of Education has been sending out those letters, and once we get them back, we'll know how to plan accordingly. Well, Pfizer would have presented their data. They would have done special clinical trials within that age group, and then they have to submit the data to the FDA. The persons from the FDA would have reviewed the data. There are several committees, and they would review the data, and once they see that it's safe, it's effective, then they would grant permission. It is anticipated that there would be another review of the Pfizer vaccines in September, and at that review, I think the intention is that they will move from getting emergency use authorization to getting the vaccines fully authorized. So it's no longer in that emergency use authorization mode, but that they'll be able now to use the vaccine. So they wouldn't have to keep sending in data because a lot of data has been analyzed. So I think that meeting is scheduled between Pfizer and the FDA for the 6th of September. And once they successfully complete that review, more than likely they will get authorization to use the vaccine. First of all, we'll have to see when the data is presented. Those clinical trials are still ongoing, and the data is not, they have not collected the data as yet. Again, by the end of September, additional data within that age group of 11 to 5 would become available, and that would be scrutinized again by the regulatory authority in the US. And once they complete that and they're satisfied, then they'll probably give emergency use authorization to be able to vaccinate children within that age group. So once the data is available and we can properly scrutinize it, then a decision would be made at that point in time. But right now it would be premature because the information is not available. However, information is available for children between 12 to 18. Well, for persons under the ages of 18 who would have been infected with COVID, we've had 3,815 persons who would have been infected. This is both male and female, and I think it's quite a number. However, most of these cases would have been mild, and many of them did not require hospitalization. That, however, can change because, as you know, we have a new variant that is circulating, and that variant is in many countries right now, more than 142 countries according to the WHO. That's the Delta variant. And we see that it can infect children, and those who are infected can get a more severe form of the illness. So it's another reason why we have to guard against the Delta variant, and the only way to do so is to immunize our children, the children population. Well, as of yesterday, we've had 282,586 persons receiving their first dose. So we are now at 58% of our adult population. And for second dose, we've had 146,500 persons. So we are now at 30.1% of our adult population receiving the second dose. Well, obviously that's not true. All the scientific information that we've had doesn't point to any infertility in women, and literally millions of women around the world would have received the COVID-19 vaccine, and we haven't seen any case of this. On the other hand, vaccines are going to protect people. They help to reduce your chances of infection, reduce chances of hospitalization, and obviously reduce chances of death. So rather than, be hesitant because of a non-existent problem, I think people ought to go and get their vaccines.
This has been our COVID-19 update. For more information, visit health.gov.gy or dpi.gov.gy and our social media platforms.